Innovating Education Learning World in association with WISE, an initiative of Qatar Foundation.
Medicine is constantly evolving as new discoveries are made. We look at how medical education is keeping up and preparing students to treat real-life patients. Would you let a student operate on you? I think I would have to think twice. But how can medical students learn unless they get hands-on experience? In this report, we discover how one centre in Canada has found a solution.
There's no time to lose. A patient arrives in the emergency room struggling to breathe. It seems her heart is failing, a life on the line. True life drama, but it's only a training session in one of the largest skills and simulation centres in North America. Medical students and healthcare professionals come here to practice care procedures. The room is designed to replicate real-life experiences. The same equipment, the same instruments and high-tech mannequins that react just like real patients.
The computer can control the mannequin to go into different heart rhythms. It can control the oxygen levels, the blood pressure. The mannequin can bleed, it can sweat, it can cry.
Yeah. Has anyone ever told you you have heart failure or COPD?
More than a third of so-called adverse events in Canadian hospitals are down to medical error, with traditional training methods seen as a major factor.
The old teaching was see one, do one, teach one, which means that watch it first and then practice once on a patient, and then in theory you're supposed to be so good that you can then teach someone else to do it. And I think nowadays, especially with this whole concept of simulation and patient care and reducing patient error, the new teaching algorithm is practice many, do one.
The simulated operation is videoed to allow for an in-depth debrief.
It's easier when I do it. No, I get this.
You really maximize the learning from that experience by the reflecting on it and then the discussing.
It's not just about the emergency room. Students also practice surgical skills for a range of procedures, such as intravenous insertions and suturing. Here, the young medics learn about an operation known as phlebotomy.
I really do think that learning these procedures on models increases our confidence drastically. If coming here and I've learned how to put in an IV, and if I hadn't done that before and if it was my first time on a patient, I'd be much more nervous.
And the more confident the surgeon, the smaller the risk of mistakes.
And of course, it is also important to train dentists. We all know how painful toothache can be. But what if you can't find a dentist to treat you? Well, in this next report from Nicaragua, we find out how one Spanish NGO has found a win-win solution.
On the road to Chichigalpa in the west of Nicaragua, an extraordinary aid expedition is underway. This is Dentists Without Limits, a group of final-year dentistry students who volunteer to treat low-income patients in remote parts of the country. The facilities aren't ideal, but that doesn't deter the many seeking treatment. The NGO has become expert in setting up treatment centres in far-from-clinical environments. For 15 years, Spanish dentist Francisco Rojas has been improvising surgeries in poor rural areas of Nicaragua, Cambodia and Madagascar. The equipment is normally donated by the students, the drills powered by a compressor.
The volunteers can participate as their fifth-year students. They've seen more than 1,000 cases, so when they go back to their universities, they already love their job, because they are helping low-income people through accurate diagnosis.
For the apprentice dentists, it's an opportunity to grow both professionally and personally, learning from fellow practitioners and the patients. After a few days in the community, the connection is much deeper than the usual doctor-patient relationship.
Maybe before I wasn't very confident. Should I do this or that? I would call the professor. Here you learn decisiveness, how to think for yourself. You see what you have to do without needing to ask anyone.
Rojas leads a team of 3 senior colleagues who take charge of the surgery. They work with the others, but mainly oversee the volunteers and help in complex operations.
I think I would never have gone to do any of this. You see things that you won't see in Madrid. You have to learn to fend for yourself, because if you don't take the tooth out, you have to take it out. You can't let the patient leave with the tooth still there.
Queues are long, but the locals are patient. This is a unique opportunity for much-needed treatment they couldn't otherwise afford. All the dentists ask for during their 3-week stay is food and lodgings, which the community is more than happy to provide. This kind of voluntary mission is now being taken up by student doctors at a hospital in the Nicaraguan city of León. The medics learn how doctors in poorly resourced clinics deal with dozens of patients every day.
After 3 weeks, they're able to do consultations to make diagnoses with the support of a doctor. They also help in getting through the workload, consult patients, conduct examinations, basic things that require a lot of staff.
It's a steep learning curve in a challenging environment, but the aspiring doctors emerge from it with invaluable experience for their future careers.
Now we talk to Dr. Magdi Yaqub, who is one of the world's leading heart transplant surgeons. We asked him about his medical training and about current developments in medical education. Let's find out what he said in this report from Egypt.
Dr. Magdi Yaqub's life is dedicated to helping others. He's known worldwide for his expertise in heart and heart-lung transplants and has won several awards. He travels the world sharing his knowledge. His Chain of Hope charity provides specialist surgical care to the developing world. In the Aswan hospital in Egypt, Dr. Yaqub runs a training centre for young doctors.
The students have a massive talent, have sometimes more brain cells than the professor, but it's not structured. They have no experience, so you have to point them in the right direction and say, go. There are now a lot of tools, molecular in particular, and these molecular tools and personalized medicine are going to change medicine in a big way.
The son of a surgeon, Dr. Yaqub studied at Cairo University and decided to specialise in heart surgery after the death of his aunt. He's worked in Britain, Chicago and Nigeria. We asked him what his first advice is for those who want to practice medicine.
The attitude to patients, you need to learn that as well. And so you go there, and even if you don't have anything now, you say, my name is X, and I want to help you. I might not have enough to help you now medically, but I genuinely want to help you. This is a principle which has to be engraved in medical education.
Dr. Yaqub is one of the few surgeons who can teach the technically demanding Ross procedure. He remains a supervisor to PhD students and has published over 1,000 articles.
There is no operation with zero mortality, but you try and get the mortality down to zero, and you have to be objective to do that. If, and only if, the person involved has a passion for the specialty, medicine, and he or she will have a very happy life only and only if they have a passion for the specialty.
Dr. Yaqub continues to act as a high-profile consultant and ambassador for transplant surgery. An inspiration for many, his methodology has saved thousands of lives.
Well, that's it for now. What do you think? What's the best way to train tomorrow's medical professionals? Do share your thoughts via our social media pages. See you again next week. Goodbye for now.
Learning World in association with WISE, an initiative of Qatar Foundation.